Now, Jess, you came back after the first couple of times and you established something.
Yes, we ended up actually mobilising community members in Kenya through existing networks of people living with HIV, mothers groups, religious groups, different existing networks. And they came together and discussed their challenges and brainstormed some of the solutions that might be possible. And they ended up prioritising things and devising their own project, community-based project.
But that was through your auspices of establishing Positive Aid?
Positive Aid actually was a secondary plan. So first of all, I was involved in the community work on the ground in Kenya. Mm-hmm. Then once we had a project idea established was when I came back home to Australia and actually looked at the kind of structures that might be necessary to partner with that project over there.
So you actually work with other NGOs before you established this one?
We were actually independent. I had done some fundraising on my own, so we had a little bit of money available to start implementing some kind of activities. But we were reliant upon me coming home to Australia and initiating Positive Aid.
Right. Now, some of the programs that you've had there, you're looking at HIV/AIDS prevention, care and support, maternal and child health, and also health literacy. We mentioned earlier that there are some cultural issues which are completely different here in Australia. How have they hampered or helped you in your quest to help these people?
Well, I think the cultural beliefs and practices over there are very different, like we were saying before, to the Australian culture. So everything has been very new for me as an individual. I've learnt a lot along the way. And in terms of actually implementing an effective program, I think we really need to incorporate what's happening in reality on the ground over there. We can't kind of introduce an Australian culture, an Australian way of doing things, because we may miss the point completely. Yeah. Not only that, we may actually cause a lot of harm in the process, create conflict or jealousy or whatever.
And destroy the program.
That's right. So we've gone quietly and we've gone in with open ears. And I think that we've allowed the people themselves to be the ones to design things, to give constant community feedback and so on, so that us as outsiders coming into this community are just open to what's actually happening on the ground and we can help in the most appropriate way.
So how many people on the ground do you have over in Kenya?
In terms of actual management that are on a salary over there, we have around 5, so it's quite a small project. But then we have a whole large number of volunteers. So we've trained almost 100 community health workers within a population of around 100,000 people where we work. And those volunteers are really integral to the running of the program. They're the ones that actually visit people that are affected by HIV/AIDS and so on.
What are some of the things that they do to assist the people with the disability?
Well, those health workers would be responsible for actually identifying the people that might need some help. We've set it up so that they're actually looking out for people in their own village areas, so it's all very familiar, and they may actually hear a story or hear word of mouth that somebody is down sick with a virus or needs some kind of help or whatever, and they're already in the community, so they probably know that person, and it makes things so much more easy to contact the person and befriend them and then advise and help them. So we provide kit bags to the health workers, and that would have things, basic medications, first aid things to wash clothes and hygiene and so on. So the health workers would actually be able to provide first aid, and their main role, I guess, is to advise and to refer to other services, because these people are not trained as doctors. They're just community members that have undergone a short health training. So we need to actually use the government health facilities that are already existing there and simply refer them.
Are those facilities reasonable?
They're okay. It's a completely another standard to what we'd expect to find in Australia, of course, but they are adequate in the setting over there, and there are nurses available.
Right, and you mentioned earlier about water. You take it out of the stream or the river. Not a great quality?
not fantastic, and you'll find that in the places that people collect the drinking water and the cooking water is where they also bathe, where the cattle come to drink and so on. So there's a lot of uses going on. There's probably a lot of dirt and germs that you wouldn't want to put into your body. And people aren't so aware about the dangers of drinking untreated water, so that's part of our program as well.
So not only the AIDS, you've also got the other waterborne bacterial type diseases that occur as well.
Yeah, that's right. And when we think about it, they're quite basic things that we do promote, things like hand washing and treating the drinking water, but they make such an amazing difference to the everyday lives of people. That's incredible.
All right, we'll take another couple of messages and come back with Jess after this, and we'll talk about how they're delivering the services.